Today we're here to address the needs of the nation of Ethiopia. I would like to remind everyone that these challenges are not just statistics, they represent real families struggling for survival, real children whose futures hang in the balance, and real opportunities for impactful change. Let's begin. Ethiopia is a landlocked country located in the Horn of Africa. Its population consists of nearly 130 million people, and although the country has been consistently developing, it has remained one with a substantial amount of disease burden. Infectious diseases are a major concern, with malaria and diarrheal diseases being incredibly pervasive. There's also a lack of skilled birth attendants, leading to high infant and maternal mortality. Ethiopia is one of the highest rates of stunting in sub-Saharan Africa. This means that some children under the age of 5 are underweight, restricting growth and cognitive development. While infant mortality is at 35 deaths per 1,000 live births, maternal mortality is at 267 deaths per 100,000 live births. The community is also experiencing a rise in non-communicable diseases such as cardiovascular disease, cancer, and diabetes. In 2015, Ethiopia's HALE was measured at 54.3 years, while the most recent data on DALYs is from 2020, with an estimated mortality rate of 554 deaths per 100,000. The rise in non-communicable diseases due to urbanization and poverty has created a sort of double burden of disease. Our action plan consists of nutritional programs such as breastfeeding promotion and support, food services, maternal and child health services, and addressing food security. It's also important to expand immunization and improve sanitation. The promotion of breastfeeding will prevent malnutrition and stunting in infants. Food aid programs will help with an infant's development as well as their mothers. And maternal health care services will ensure prenatal care, since having more skilled doctors in attendance improves infant and maternal mortality rates. Addressing food security can help prevent deaths caused by non-communicable diseases as well as poor diets, and improved sanitation and immunization can help prevent the spread of viral, bacterial, and vector-borne diseases.
The biggest risk factor for negative health outcomes is malnutrition. This can lead to a high likelihood of health complications in the future. Other risk factors include things like lack of sanitation, clean water access, and high blood pressure. People most at risk include people living in rural areas, because there's a large number of Ethiopians who are chronically underserved in these rural areas. This means that the risk of disease, injury, or illness is much higher for them over a city dweller. Another group is women and children. Women, particularly pregnant women, are vulnerable to HIV/AIDS, as well as other complications along with the pregnancy. Children face threats of malnutrition, diarrheal diseases, and respiratory infections. The three biggest public health priorities for us are the first being addressing tuberculosis. Ethiopia ranks number 7 out of countries with the highest rates of TB. This is a glaring problem that must be addressed through health interventions and education. The second public health priority is lowering the prevalence of HIV/AIDS. Ethiopia has a high rate of HIV/AIDS, and it must be a priority because of how dangerous the disease can be. This can be prevented by educating the population on safe sex practices and general hygiene. The third public health priority is to expand access to healthcare services. Healthcare services in rural areas of Ethiopia are lacking, including trained professionals, funding, supplies, and hospitals. Since the burden of disease in Ethiopia is already so high, healthcare access needs to be expanded to those who need it the most. It's also important to note the difference between a health issue and a burden. An issue refers to the single specific problem or condition a person is facing, while a burden looks at the wider consequences that this illness has on a society or an economy.
In terms of material resources, essential supplies include medical equipment, vaccines, nutritional supplements, educational materials, sanitation infrastructure, and transportation for the distribution of resources. Using existing logistics networks from NGOs and local government structures will improve operational efficiency and reduce delays in implementation. The feasibility of these recommendations is supported by evidence from past interventions. For instance, Ethiopia's expanded program on immunization, otherwise known as EPI, has significantly reduced child mortality rates by systematically increasing access to vaccines. Similarly, nutrition programs like free food services and breastfeeding support have shown substantial reductions in stunting and malnutrition, evidenced by successful pilot programs in some other similar African regions. We would also like to strengthen collaboration between international funders, local governments, and NGOs alongside the community's engagement and education initiatives. These evidence-based strategies collectively improve the likelihood of achieving meaningful improvements in Ethiopia's public health outcomes. In the end, investing in public health is vital for Ethiopia's future. A healthier population boosts economic growth with a strong, resilient workforce. It also eases pressures on healthcare systems, saving costs and enabling funds for other priorities. Strong healthcare systems reduce disease outbreaks. This ensures national stability. To achieve this, leaders must back our action plan, allocating resources wisely and collaborating with global partners, NGOs, healthcare workers, and community leaders to tackle these urgent health challenges.